Yeah.
Do you have any studies for these Bio-Strath in ICU patients and patients are chronically sick, critically sick? Any studies of these products, liquid or tablets, administered to ICU patients who is immediately very down in defense?
Intensive care.
And yeah, intensive care unit. And number two is that the hormonal studies in this anti-aging world right now. They're talking about what is hormonal imbalance. Even men have andropause, and then women before menopause and after menopause. Do you have any positive studies or things like that regarding Bio-Strath regulating hormone naturally, or any subjective and objective evidence? Thank you.
No. I'm sorry, but you have also to see the Bio-Strath is a food supplement. It will not influence hormonal balance like that you can do a study on this. And the studies we have are more, as you see from the parameters, when we have the pre-geriatric study with 184 people, are more parameters on performance, on calculation tests for the short-term memory capacity, or on ergometric tests for the performance test. But it is not a blood analysis on certain components of the blood. It is more, it cannot fully be compared with a scientific study of this level. And the first one was intensive care.
Yeah, intensive care, whether it's been used in intensive care situation, acutely ill patient.
You can, when the product is not too heavy to give for intake, then you can use it.
But most of the time, intensive care they will be on parenteral.
On them, yeah, exactly. Then you cannot use it.
Oral.
Yeah. And this is why we thought for doctors to launch the drops. And it's not for intensive care, but drops is then for people who can still take orally a little thing. Then it would be easier to give drops in water, in a little water.
And this concentrated.
Yes, more
patients maybe.
There is a drop preparation available?
We should register it.
Yeah.
Ah, you have it here. This is in Switzerland. We have a drop form, which is an alcoholic extract of the herbal yeast. And this is faster absorbed by the body. And this can also be given to people who have colon problems or Crohn's disease or such things, because this goes not on the normal digestive way. This is already absorbed by the mouth mucosa. And when we put 20 or 30 drops into a little water, the alcohol is not the problem, and then it can easily be given. When people have, also people with certain stomach cancer, they cannot take the liquid, that's too heavy. When you see the syrup what we have here, with honey malt and orange juice, for certain patients you cannot use this. And tablets may be an alternative. I always say tablets you can powderize, you can make it a powder. But we will now, we discussed yesterday, to launch the drops would be a good thing for the doctor simulation.